of the International Society of Men's, there are more women pushing men in wheelchairs rather the other way around because of this fact: stroke and cardiovascular disease, lung disease, chronic obstructive lung disease, also more prevalent in men, mainly driven by smoking, metabolic syndrome, certain cancers, lung and colon. Although lung and colon affects men and women, it has higher morbidity and mortality and earlier in men. HIV definitely more prevalent than in men. Suicide death is 4 to 1. This is probably the most remarkable pieces of information. If you look at depression, 2 women to 1 man. If you look at suicide attempt, is 2 women to 1 man. If you look at suicide death, is 4 men to 1 woman. So somehow the mortality from depression is much more prominent in men. Now, is that because men are more violent, they use more lethal methods for suicide attempt? Or is it because depression is more morbid when it happens in men, more severe, more vicious? We don't know. So this is an area of high interest, high research. So again, brings all this as issues of men's health. The third item are behaviors with high prevalence or special impact in men. Smoking, any abuse is more men. Alcohol abuse, drug abuse, overweight is more men. Unsafe sex, definitely. And some of these findings we did a study recently on a database from the CDC, the Centers for Disease Control, looking at teenagers, ladies and gentlemen, teenagers. We looked at data of teenagers by gender, boys and girls. And boys have more risky behavior when it comes to health. More smoking, more alcohol abuse, more drug abuse, more unsafe sex. In addition, low utilization of health services, especially preventive services. The most ironic piece of information is dentistry. Men go less to the dentist for annual hygiene and checkup than women. It's a reproducible piece of information, and even if you correct the data to the availability of insurance and access to care, men utilize health care less, hence less prevention. So these behaviors are point of interest in men's health. So that's number 3. Number 4 are social situations with high impact or special impact in men. Armed forces all over the world, 90% are men. Incarceration, prison. In the United States, 90% of people in prison for any crime are men. Shipping industry, construction industry, others. There are a number of situations where the majority of those involved are men, and that there are health consequences to those involvement, which makes it of interest in men's health. So those are the 4 areas that make the scope of men's health, and we had a good discussion about this yesterday in the core group with Dr. Rajiv Sood and the wonderful group that came together. So the next couple of slides is about uroandrology and how it relates to